go ahead with her next case. Dr. Anusha is a qualified homeopathic consultant with about 15 months of experience. She is a very young practitioner but has a lot of achievements as feathers to her crown. Like she has done a lot of TV shows for multiple ailments like diabetes, arthritis, varicose vein, autism, PCOD, and hormonal disorders. And she is rated quite well by her patients, and she's joined KQS recently. So, Doctor, we are waiting for you to take over the next session.
Yes,
Uh, Dr. Anusha.
yes. Hello, everyone. Good afternoon. So it was a very nice session by Dr. Shelley. So as we all, am I audible, sir?
Yeah.
Audible, but there is a echoing. Echo is there. Just take care.
Just a second.
Okay.
Yeah. Now is it clear, sir?
Yes.
Yeah.
Yes.
Okay. Well, it was very nice session by Dr. Shelley. So, as we all know, pediatric case taking is one of the difficulties what we see in a day-to-day practice. So, already we have discussed few cases. Dr. Shelley has explained very in detail. She has explained. So, let me add few things for that information. So before starting the session, let us start the session with a very beautiful proverb. In the practice of medicine, as in life, nothing is so quite gratifying as making a child smile. Bringing the joy of good health to our little patients is wondrous gift for everyone involved. So today, here in this session, I would like to, brush up the things like discuss about the pediatric case taking, homeopathic approaches in the pediatrics, milestones and developments, and cases. So, in our day-to-day practice, we see so many cases. There are so many cases that approaches us in the pediatric ailments, right from acute and chronic, ranging from mild infant rashes, allergic tendencies, infant colic, asthma, pneumonia, diseases like malaria, dengue, tonsillitis, etc. And the most common, the pediatric cases, what we get is what difficulties in dentition. So, well, let me, just in a short, let us discuss about the pediatric case taking, how we go with the pediatric cases. So first, we'll take a chief complaints with the causations like how it caused, with what complaints the patient approached, like whether it's after vaccination, post some any of the indispositions, emotional turbulences, physical factors, medicines, etc. So next we have to take a details of present illness. Next, associated complaints or the concomitants. We all know this. Just I'm in this thing I'm telling you. So past history. Any illness in the previous past history of any previous illness. Hello.
It's audible. Continue.
Yeah. Past history, any previous illness, their nature, severity, and at age, which age it occurred. Either the at what any illness the previously the baby suffered from, nature of that particular thing, any severity, and all we have to take. Prenatal history, that's mother history, is very important during pregnancy. So first we have to take when the newborn or when an infant approaches us, we have to first rely on the maternal history. So any emotional stress during pregnancy, like anxieties, fear, tension in relationship with husband and any other family members, friends and her reactions to that, how she reacted with that particular situation, and during pregnancy, what are the stress factors she underwent. For example, I would like to give you one case I had wherein I'll explain. That was a very beautiful case of autism, what I got actually. So there, what happened, the mother, she had a consanguineous marriage. She married her own uncle, so she was not ready for a baby, but her in-laws forced her for a baby, and later, and that, that her emotional turbulence or the emotional stress that impacted her pregnancy, and that raised her blood pressure and leading to so many problems in her future. So next, we have to look upon economic status of the family, because antenatal checkups and so many vaccinations and etc. We usually homeopaths, we don't give that much importance for vaccinations, but economic status of the family is very important here, because some people, they can't afford treatments. For that, we have to take all these into consideration while taking a case, because here in pediatric case taking, what happens, we can't take each and every symptom because from the baby. So first we have to look for the chief complaints in, and along with that, maternal history also plays a very important role. And attitude, see, just now I told you, attitude of not wanting a baby at all or at that time. So next, birth history. So here what happens in this birth history, we have to look for any normal normal delivery, either it was a full term delivery or any C-section. If C-section, what was the cause behind? Any CPD, cephalopelvic disproportion, all that we have to take into consideration, and what was that impact on the baby and also on the mother. That helps to find a constitutional remedy for both mother as well as the baby. So next, immunization history: when, how many times, and which one. Here I would like to take a few vaccinations. Post that vaccinations, there are so many cases that has arrived. I would like, I don't want to mention of that particular vaccine actually, but after that, there have been so many post-vaccination vaccinational problems that have arrived in a baby. So this is also very important for us to look for any vaccination, post-vaccination problem has arrived, or any immunization status. This all we have to think about. And when in newborn cases, we have to look for feeding history: how often, fast or slow, latches, breast milk or formula feeds. If formula fed baby, which milk? In village area, they'll use a cow milk. How many times a day they'll feed, and how often, and which milk. Any diarrhea associated with that, and regurgitation, colic, etc. And when weaning started, if weaning started, which type of food they are giving to the baby. That is also very important. This we'll consider in especially in the cases of colic. Next, developmental history. Developmental history, here we have to look for the milestones like smile, dentition, crawl, walk, talk, etc. And in cases of preschooling children, we have to look for any precocity, any precocious puberty is there. So next, we have to look for the family history. How old are the parents? How many children are there in a family? Their age group. Any stillbirths, miscarriages, or childhood death in the family. This also plays very important role. Any illness in the siblings, parents, or near relatives. I had a case of febrile convulsions. It was a seizures wherein her grandmother suffered with the same condition, wherein the patient also approached with the same conditions. When we keep on digging the case, if we look superficially, we get, of course we get the symptoms, but it's very superficial. If we go on digging the case, we'll get a deeper and better approach, and it'll be very easy for us to select a constitutional remedy. Next, social history is also very important. So how the society, living conditions of that particular family, economic status, as I mentioned, and mother's occupation. Sometimes what happens when a mother is, she's a working woman, she can't feed her baby properly, and that detachment starts. So that time what happens, the baby might be feeling, like, where is my mom? These some types of symptoms, that emotional turbulence that starts in the children. We have for each and every, we have to take each and everything into consideration, and before going into the proper case, we have to take a maternal history, separate family history, developmental stages, all these things. These are usually pediatric case taking, which is followed by each and every pediatrician, not only homeopath, allopathic side also. But when we move to a homeopath, most of the renowned practitioners, pediatric practitioners, they tell observe the child. Main thing is to observation, and only observation. So what we have to observe here, so first thing is gestures, hand gestures, how the baby behaves in front of you. Whenever the baby is outside, when he enters your clinic or when he enters your cabin, how the baby behaves, how child behaves in front of physician and others. That is very important. The child will hide from you, they may snatch your pen, tear papers, or jump on chairs or examination table. Anything they do indicates the who the child is. So we have to, the main sole thing or the main important thing is to observe the child. So constitution, we can't get exact proper symptoms from the child itself, but only thing the physician has to do, we have to do, is to observe what he does in your clinic. So usually when a patient approaches me, I'll give them some kind of paper and a pen. Let them draw something, whatever they want. If it's not like schooling children, if they come to me, let it, I'll just give them a paper or pen and come different color pens, color pencils or pen, crayons, whatever, so that what color they choose, what type of drawing they draw, doodle, etc. Each and everything, and I'll ask them, their parents, to maintain a record book how he behaves with the music. Some child, especially the autistic child, they are very sensitive to music. They'll be lost in their own world. So sometimes the child, when it enters the clinic, it'll be different. They behave different. But when at home, he'll be different or she'll be different. So you have to keep a note. You have to ask a parents to just take a note of whatever they do outside. When you take them to park or when you take them outside, how they behave, how they behave at home, and how they behave at a clinic premises and inside your cabin. So these all things we have to take into consideration. Next, reaction of the child during the case taking. I have written here, child's response to patient's narration also plays a very, very important role during case taking. So what happens here is, when you approach a child, when you ask, "Ken martidi putta, what ಏನಾಗಿದೆ ನಿಂಗೆ? What's wrong with you? Kya hua beta?" And say, whatever you ask the child, some child, they get offended. They may hide from you. They doesn't react what's happening. So, and sometimes they may giggle, they may laugh, start laughing. I had one case, that autism case. He used to bite his mother. Whenever he used to see strangers, he used to bite his strangers. So that type of response also we have to see here. So next is reaction to parents and to the physician. What child says, how they speak, their facial expression, their hand gestures, everything we have to take into consideration. So child is restless. Some children are restless, playful, obstinate, sensitive, irritable, throws things, cling to parents. For example, calcarea and Barita patients, they always cling to parents. And some child, like phosphorus child, they always comes, they're so pampering, they'll come and they'll sit beside you. So Lacaze's children, when the child stamps their feet on the ground, especially after a bout of anger, that's see here, I have mentioned, I have taken that rubric here, stamping feet with. There are so many remedies. Hyos is there, stramonium is there, veratrum is there, ignitia, calicar, so many are there. The child stamps, especially anger, out of anger. Next comes Lacaze's children have a constant habit of spitting. I have taken that rubric here. Silicea children would try to hide, and phosphorus child would like to sit beside you, as I said. And the most dangerous tarantula and chamomilla children are very difficult, very difficult to handle at clinic. So observations, again, what we have to observe. See, reactions to fan, food, water, and other substance. When a children or when a child enters your cabin, so that time what happens, you'll be keeping your stat, awards, so many things like pen, laptop. So how this, I had one patient, he used to snatch a pen from me and used to break. I don't know how many pens he broke actually. So that kind of reactions also we have to observe in a child, either it's a destructive or non-destructive. That implies, that itself proves that how the child is. So next is generals of the child, including build, diet, cravings, aversions, thirst, sweat, sleep position, bowel, urination, thermal, etc. And in the cases of newborn and infant, story revolves around the way they eat, sleep, and their milestones. I have a chart of milestones here. So newborn to 1 month, they get a head control, arm control, and after complete 3 months, they try to turn belly to back, and they try to creep. These all are the milestones I have, put it in a picture form. And this is after completion of 6 months. When you ask some questions to the baby, or when you try to examine the baby, how they react. Approaching remedies. See, we have so many remedies here. I have taken the rubrics also. So, Apis mellifica, belladonna, chocolate, crotalus, sulfur, tarantula, and withdrawals. When they don't, when you try to talk to a baby, when they hide themselves, or when they doesn't respond to your verbal commands, or when, I'm sorry, not verbal commands, when they don't talk to you, or when they don't allow you to examine. So withdrawal remedies also, anticrudum, anticard, baritacarb, sina, iodine, macmure, so many and so many. So next, first one is, this is a behavioral analysis we have to do in each and every child. So first is in the sociability of the child. Next comes energy level and activity level. So energy. Usually this energy level and activity level we assess in the cases of ASDs, autistic children, where some children are hyperactive physical and hyperactive mental. Hyperactive physical, for example, some autistic children, they'll be making the very vigorous, fast hand gestures along with screaming, laughing. So that time, what rubrics we can take? So there are so many number of medicines here: belladonna, china, coffea, calicrude, sepia, silicea, and many more. Hyperactive mental, aconite, hyos, and iodine. Hypoactive, some children, they'll be lost in their own world and they don't react at all. So that what these are the easy rubrics for the which we can take. So hypoactive, even there are so many medicines, but these medicines are there along with the other symptoms, and along with the complete case taking, along with the proper analysis and evaluation and a proper case taking. We have to prescribe a constitutional remedy, of course, but this helps in easy of selecting the rubrics. Determine the anger frustration response. either the patient is destructive or non-destructive. As I said, I had a patient of autism wherein the patient, he was so, he used to break the pens, he used to take, her mother used to beat him, don't do that. But that time also, he used to snatch a pen, whatever it may be, he used to snatch a papers, he used to tear everything. We have to consideration. So again, we have a rubric here: destructive and non-destructive. In destructive, we have so many remedies: Hyos, iode, kali iode, naxwamika, opium, whereat, so many things. And non-destructive. And here also we have lycopodium, sepia, pulsatilla, and many more. Determine the thirst and temperature, determine the constitution and character of the child. These are the behavioral analysis what you have to uh, do it on the child to study who the child is and to select the proper constitutional medicine. So, well, I would like to discuss the case of autism here. I had a patient, 6 years old boy, came with the complaints of speech delay, sensitive to noise, and restless sleep. So this boy, when her mother, she came with him and she said, "Ma'am, I don't know what's wrong with my boy, but every time he screams at night, he laughs at night, and this boy, when I observed him, he never used to sit at one particular place. He used to jump around. He used to jump on examination table. He used to, sit, he doesn't sit at a particular place. Even I watched him outside the cabin where he was roaming every here and there, and he used to make a typical, a sound like this. And hand gestures were very, very prominent in this case. So mentals always makes hand gestures while looking at a stranger, especially like this kind of hand gestures, and like a counting something, he used to do like this hand gestures and used to scream. And I don't know what he'll be lost in his own world. If you forcefully, if you drag him towards you, like mother, she used to do, she used to ask him, come sit in front of doctor, she will see you, she will examine you, come. She was not knowing that it's an autistic child, but she used to do like that. I used to observe her, that child's mother and also that particular boy, how they both react. So when I took his complete case, like observation, everything, next I took her mother's case, that was typically, the how restless she was during her pregnancy. That restless intense in an intensified form I'm seeing in this particular child. So always makes hand gestures while looking at a strangers, doesn't respond when approached. When talked to, I used to call him Chingmai, what you doing? So I mean, by his name, I used to call him. I used to tell so many things for him. Come here, bye Liputa, come here. I'll give you something. Come here, come and talk to me. But he never ever looked at me once till date. So many follow-ups, so many, every time observation. But till, these days he's sitting on his mother's lap, and it was a very wonderful case I had. But that restlessness, what she told, what she narrated during her pregnancy, same kind of restless, mental and physical restlessness, both restless I'm seeing in this particular child. And low verbal skills, restless, laughs suddenly. One day her grandmother came to me and she said, I don't know, madam, why this boy suddenly laughs at night. All of a sudden he sits and he laughs at night and bites his mother after hand gestures. He used to make this kind of hand gestures when his mother told him, come and sit here. We have come to meet a doctor. Come sit here. He used to bite his mother, makes a sound while making hand gestures, attacks the strangers suddenly and tries to bite them. Always in a constant motion, grinds the teeth with excitement during day, destructive, grabs and breaks the things, irritable and sensitive to music. The sensitivity to music, it's very common in autistic children. Most of the autistic children, like severe autistic children, moderate, depending on the grades of autism, this symptom, what I have noticed, it's very common. Next, maternal history, and as I told mentioned, parents they had a history of consanguineous marriage, high blood pressure during delivery. She had so much of stress, she was so anxious, and during delivery she had a high blood pressure, and she underwent a C-section. So generals eats hurriedly, eats very fast, restless even in eating. He doesn't sit at a particular place and he doesn't eat calmly. Restless at night, laughs while sleeping, uncovers himself, constipation, screams while passing through. So when we assess the stages of the autism, it's from moderate to severe disability. So rubrics, what I have taken here in this case is that mind talked indisposition to slow learning, general arrested, indifferent surrounding to mind gestures, hands motion, plays with finger, mind gestures, makes involuntary motion of the mind, childish behavior, generals dwarfness, mind indifference, loud ones, generals vaccinations, ailments after. Why have taken? You may ask me why vaccinations ailments after, because usually when a patient, pediatric case approaches us, we need to ask about vaccinations. Like any, this lady, when I asked her, this child's mother, she said after taking MMR vaccine, that's the first shot, so he developed a febrile, high fever, and after that he developed a febrile convulsions, and we were not knowing he was, after he was quite all right after taking some certain medications and all. After few months of that particular thing, it started like this. Once he had a febrile convulsions, then after this start, mouth speech changed, mind grimaces I have taken. He used to make certain official, grimaces. Answers aversion to. He never answers. Whenever you ask him to, call his name, whatever you show some chocolates, whatever, he'll never answer. He'll never look at you. He'll be lost in his own. Generals, children complaints with mutism. He'll never reply also. So these are the things, the rubrics I have taken, and after proper repertorization, I gave him phosphorus 32 dose followed by SL. So SL here, I have usually. She said whenever he eats sugar or any sugar things, she said his complaints increases after eating sugar. So she thought Estelle is very sweet pills, madam. Whenever he eats this, he gets he starts laughing. So I said, okay, madam, okay, ma, you mix it with lukewarm water and give him, he'll be fine. So medicine along with this also helps to control all the symptoms, and now he's perfectly all right. Now if I call his name Chinmay, he'll responds and he sits on his mother lap, and it takes some time, but slowly and gradually everything will set better. So next I would like to discuss an acute case with you all. It's a 9 years child came with a complaint of loose stools with the motion since 3 days. Stools were so offensive along with the colicky pain. Intensity of pain was very much. Child screamed while examination. So frequent urge to pass stools, but in little quantity along with the flatulence. That's the offensive flatus. Well, when I was examining her, her abdominal, this thing, so she screamed, Madam, don't touch me. After examination, again she rushed to washroom. So there was a mild grade fever associated with rice fever. General's thirst, it's reduced, yellow urination, and low. So past history, she was perfectly all right. No other symptoms has been noticed, or no other any probable, not significant past history. Physical examination, it was 99.4 fever, and pulse it was 100, and moist tongue with thick coating. Skin, any no signs of dehydration. Bowel sounds, it was an intestinal hurry, and remedy sensation of pain. And here, main one symptom I noticed here is that she used to, bend double. in order to relieve a pain. So here I have mentioned it as doubling up relieving modality of pain and pathology. So here, after taking other conditions also and other other the symptoms also, I have prescribed her calcarea phos 34 dose followed by SL, and child was advised to take more number of oral fluids. So here I'll sum up my session. Thank you. Thanks for patient listening.
Thank you, Dr. Anusha. It was really nice. Your talk was very interesting, especially the remedy that you have selected for these two cases was some kind of an eye-opening experience. And I
Stop.
have rarely seen this kind of a prescription where calcarea phos was given for an acute remedy. That's really nice. I'm so happy to see that, and the results are also interesting. There is a questions like what is the duration of the treatment for the first case?
Yes.
Somebody has asked.
See,
So
actually, depending
can
on
you please
autism, in
answer that
especially in
question?
case, shall I? Yeah. Yeah, autism. See, autism in autistic cases that depends. Actually, we can't tell exact duration for these cases because, first I told you how the patient reacts. First, we have to observe how the patient is reacting and see observation not only from one side, no, from my side. Even I'll ask a patient to keep a note on how he reacts, how he, and how in home how he will be, how he reacts to the music, everything. So after taking for this particular case, I almost took 4 to 5 months because first I gave him depending on his symptoms. Actually, that was one mistake I did. I gave a tarantula.